Hi, I'm A.E. Chandler, author of books of original history. So, books about little known people or events surrounding popular history. And I keep hearing on the news that we're experiencing something unprecedented with this pandemic that we're in the middle of. And I just keep thinking about the Black Death and a lot of the similarities that are showing up between what we're experiencing now and what was going on in the middle of the 14th century. So I thought I'd make a video and talk about that. If you want to learn more about the Black Death, there is a book called The Black Death by Philip Ziegler that I think is really informative. If you're looking for something more comforting than that, then I've got a book of devotions, Into the World, 62 Devotions to Edify and Inspire. Or if you're looking for escapism, there's my historical novel, The Scarlet Forest, A Tale of Robin Hood. So in this video, I want to look at kind of an overview of the Black Death, and then kind of a compare and contrast with the Black Death and the current pandemic. And then I'll talk about a village in England that actually had to undergo quarantine for a number of months because they were experiencing an outbreak of the bubonic plague. And then at the end of the video, I'll have some ideas for what you can do in quarantine with you, with kids, and just maybe give some suggestions on that. So the Black Death started probably in 1338 in Asia, and it spread to Western Europe, sweeping across the continent from 1347 to 1350, thereabouts. And it caused the deaths of, people say, anywhere from a quarter to half of the population, and the best estimate for how many people were actually killed was about a third of the population of Europe. Obviously, we can't know for sure. It's a little tricky with these statistics. So in the medieval period, you're looking at things like, well, we don't have proper censuses to go by. The closest thing we have really is the Domesday Survey from 1086 in England, where there's about 2 million people in England, but even Domesday doesn't cover the entire country. And there's also a pretty good theory that the population of Europe was actually in decline from the beginning of the 14th century up until the Black Death anyway. So it's really difficult to know what numbers we're looking at when we don't always have the best records. And you can kind of understand why we wouldn't have great records during the Black Death, because so many people were dying, and you're just trying to keep yourself safe, keep your family safe, make sure that you are putting food on the table. And just with the lower literacy rate and the fact that so many priests, the literate people, were dying because they were also tending to the sick, it's really difficult to get a sense of how many people died, how many people were alive to begin with. There are some villages that were completely wiped out, so obviously you're not going to have a good record of how many people were there, or how many people actually died as opposed to ran away and maybe just never came back. So we're seeing the same kinds of problems with getting accurate numbers for the current pandemic. Like, there aren't enough tests available, or some people are counting potential cases, some people are counting actual cases, and we're also seeing a lot of confusion in the numbers. People aren't believing some countries what they're actually reporting, especially countries that are dictatorships are more likely to be covering up numbers to make themselves look like they're more in control. So it's difficult to know the exact numbers, especially when people, maybe they have symptoms but they're not getting tested. So there are lots of reasons why we don't have accurate numbers, and the numbers that we're seeing now are, doctors are saying, from a week or two ago. So even though we have these really precise numbers, like you see, exactly 76 people have it in this province, and exactly 342 people have it in this state. Those aren't completely accurate numbers because there are so many different factors going on. And I'd say that, especially in China, like, people are saying that now Italy and Spain have their death tolls surpassing China's. Well, the official death tolls are surpassing China's, but again, like, in China, it wasn't openly acknowledged by the government for about 6 weeks that this was going on. There are cases that are being classified as death from pneumonia, death from influenza instead of COVID-19, and there are also cases of people just disposing of bodies in China as quickly as they can without testing them to see the exact cause of death. So we don't have the correct numbers out of China to be comparing to what we think we should be seeing in other countries. And the estimates that I've heard are that the death toll in China is probably 5 to 10 times higher than the official numbers. So that's why we're seeing a higher death toll officially in countries with much smaller populations now, is because of the difficulties with reporting accurately, both now and at the time of the Black Death. There are some misconceptions about the Black Death. So one of them is that people use the Black Death and bubonic plague interchangeably, and you can't really do that accurately. The Black Death is specifically the phenomenon in Western Europe from 1347 to 1350, and bubonic plague is an illness. And another misconception is that the Black Death is just bubonic plague. Actually, it's a combination of bubonic plague, pneumonic plague, and septicaemic plague. And a third misconception is that everybody who gets bubonic plague dies. And that's not true either. In the Black Death, you were probably seeing between 60 and 90% of the people who got bubonic plague ended up dying. So you did have a chance of recovery. And with bubonic plague, of course, there are the classic signs. You get the dark buboes, the swelling of your glands in your neck, your armpits, and in the groin area. And it's transmitted through the bites of fleas. But the good news is that the fleas have to have an animal host. So a flea can't actually bite a human with the plague and then bite another human and infect them with the plague, because in the incubation time in the human bloodstream, there's not enough plague bacilli that build up so that the flea can actually infect another human just from biting a human. The flea actually has to bite an animal that's infected with it. With pneumonic plague, that was, of course, more deadly. You could expect pretty much everyone who got pneumonic plague to die, and to do it within about 2 days. So pneumonic plague is the most infectious of the Black Death trio, and every time it affects the lungs, pneumonic lungs. So every time someone exhales, they're exhaling plague bacilli, and they could even be coughing up blood. And then the third kind, septicaemic plague, that infects the blood. So then you actually do get infections from fleas that bite an infected person and then bite another infected person, because the infection is just so virulent in the blood. And this is the kind that can kill in hours. So with septicaemic plague, this is the kind where you get stories about people, going to sleep perfectly healthy and just never waking up. They just die in their sleep, because it can just kill in hours. And it's septicaemic plague and pneumonic plague that you really have practically no chance of recovering from. So it's those three combined form a pretty scary triad. So people were understandably afraid for their lives, and there was a lot of uncertainty then, just as there is now. fortunately we're dealing with something a lot less deadly, but it's still, pretty unnerving, the effect that something like this can have. And I think part of the reason for that is that in our society now, we're not really used to the idea of something like this happening. But at least in the medieval period, they had some kind of frame of reference where a lot of people, unfortunately ended their lives because they caught an illness. And it's not really something that we think about now, that, you could die before your time because of some kind of infectious virus. It's not something that we really expect to happen. And even in the medieval period, even though this was something that they were more familiar with, they weren't familiar with it on this scale. And so it was pretty terrifying for them. So where did the Black Death come from? The best theory is that it originated in 1338 at Lake Issyk-Kul in what is now Kyrgyzstan, and spread next door into China, went on into India, and eventually entered Western Europe through Italy. It came into Italy because of the trade that was going on by sea, and we can see the same sort of pattern with the current pandemic, where because of strong tourist and trade relationships with China, Italy has been pretty much the first and hardest hit in Western Europe by this. We can see a pattern of new diseases entering the human population because of contact with wild animals. So even though some of these diseases started out in bats, they transition into the human population when humans interact with wild animals. With the Black Death, it was probably the Manchurian marmot. In the 2002 SARS outbreak that started in southern China, it was most likely a civet cat, and the current pandemic is probably going to be traced to pangolins. And these animals are brought into different wild animal markets and restaurants and wet markets in China, and they're being poached from the wild. I just want to digress for a minute here to talk about pangolins. We don't know if they are the animal source of this particular outbreak, but they're one of the candidates, and it's not their fault. They're the most trafficked animal in the world, and they're out in the wild, they're very shy, minding their own business, and people come along and poach them. There are 4 species in Africa and 4 in Asia, and it's the most trafficked animal in the world. It's actually a really cool animal. It's the only mammal with true scales. It goes around eating ants and larvae and termites with a sticky tongue that's sometimes longer than the length of its entire body. It's a really cool little animal. And this is a wooden sculpture of one. It's probably the only pangolin you're likely to see. I talked to the head of an anti-poaching unit in Africa recently, and he said that in 31 years he'd only seen 4 pangolins. So they are, in big trouble in the wild. And this is a global problem. They are consumed in India, Sierra Leone, Nigeria, Indonesia, and most notably in China and Vietnam. That's where most of the consumption happens. And now, with a lot of the Chinese pangolins having already been killed, they're starting to import them from other areas of Asia and from Africa. So the reason that pangolins are so sought after is in traditional Chinese medicine, they're thought to cure everything from acne to lactation issues to ogre possession to hangovers to breast cancer. And when you're eating a pangolin, because you can afford it, because it's such a high-ticket item, you're thought to be, really high status and, just a really, neat person to hang out with. But what they do usually is the pangolins are stored off-site, and people in a restaurant in China or Vietnam will order them about 2 hours ahead of time, and the pangolin will be brought in. The customer will get to see the live pangolin being weighed and killed in front of them, so that they can be assured that what they're getting is actually pangolin meat. And it is illegal to eat pangolin in China and Vietnam, but unfortunately these laws aren't always enforced, and so these restaurants still exist. And I just thought I'd put that out there just in case you're wondering what a pangolin was exactly. Poaching is the reason that illnesses like the bubonic plague, SARS, and coronavirus are entering the human population from the wildlife population. And, we see this in the wildlife market where they're sold either as pets or as food. And we can see this happening in wet markets throughout Asia where the hygiene standards are lower. You just see piles of meat that come from a variety of animals, and it's not packaged in any way, shape, or form, and people just pick it up with their bare hands and squeeze it to see if they want that piece of meat, like we would, squeeze an orange or something in a grocery store in the West. And you can kind of see why people would want to shop in a wet market as opposed to a grocery store, because the food is less expensive. But there are also stands in the streets outside of the wet market that can't even get into the wet market, and the hygiene standards there are pretty much non-existent, and it's just a really dangerous situation. I know that there's been a lot of talk about having grocery stores cut down on the amount of packaging that they use on food, but there is a reason historically why we are packaging our food. It's to prevent the spread of disease and illness. You don't want someone like in a wet market squeezing the different pieces of meat until they find the one they want, and then you come in and you buy that piece of meat that 50 other people have squeezed. It's just not very hygienic. There are certainly areas where we can cut down on packaging to help the environment using less plastic. But in my opinion, I don't think food is an area where we want to do that, because it is so important to make sure that the food that we're getting hasn't been sneezed on by other people, breathed on by other people, touched by other people who haven't been washing their hands. And we can kind of see this in China a bit, where there are these wet markets, and there's also family style eating, like here at this restaurant. And it's really nice to have family style eating. It's a great way to get together with people. But when you have tens of thousands of people getting together and having big family style community meals in the middle of an outbreak, you can see why it would turn into a pandemic. We can see the importance of education in all of this, and how a government shouldn't be trying to ignore a problem like this, but really get out there and tell people what they need to know so that they can stay safe. And that's a lot of what we're seeing now, with people being told to practice social distancing, wash their hands more, disinfect more, and really make sure that they're keeping themselves and the whole community safe. When comparing the Black Death with the current pandemic, one area where we're seeing a difference is in who the fatalities are. So with the Black Death, we were seeing just fatalities across the board. It wasn't like other illnesses that people were familiar with at the time, where they only carried off the very old or the very young. It was everybody. You could be in the prime of life, you could go to bed feeling perfectly fine and never wake up. With the current pandemic, what we're seeing is that the fatalities are people who are immunocompromised and people who are elderly. So that's at least one silver lining that we can have in all of this, is that children, even if they do get the coronavirus, they're going to have mild symptoms. Maybe you won't even be able to tell that they are having symptoms. And that is at least one thing we can be thankful for. During the Black Death, you would see physicians walking around in outfits like this. The idea was that in the bottom of their beaky mask there, they would put some herbs that would smell and hopefully drive away the sickness. And this didn't particularly help. In the current pandemic, we're seeing a lot of people wear masks, but we're not necessarily seeing them wear the right masks or wear the masks correctly, because if the mask isn't airtight, that's not ideal. If you're wearing it long enough that your breath is getting it wet, then it's no longer working properly. And we've seen people who put it over their mouths but not their noses. So it really matters how you wear the mask and what kind of mask you're wearing, whether or not it is effective. During the Black Death, a lot of the victims were priests, because they were the people who were tending to the sick, visiting the sick. They were making sure that people were being buried in the churchyards, at least at first, before the churchyards became too full. And so we're seeing a higher rate of mortality during the Black Death for priests than for the general population. For priests, it was probably around 43-45%. And this is parish priests. These were the guys who were out in the community working with people. And we're seeing the same sort of trend beginning to happen now, where a lot of healthcare workers are becoming sick. Another unfortunate similarity that we're seeing between the Black Death and the current pandemic is that there's some scapegoating going on. So during the Black Death, there were some communities on the continent that were targeting Jewish communities and saying that they'd been poisoning their water sources in order to make them sick. And unfortunately, some of this is going on now, where a few people around the world are assuming that all Asians are sick or all Chinese people are sick and going to infect them, which is a ridiculous generalization. And we even see in China that people are discriminating against people specifically from Wuhan or from Hubei province, and even beating them in the street. And we're also seeing that just like in the medieval period, you might put someone in the stocks if they'd committed a crime. You'd clamp their ankles in there, and they'd be in there for public humiliation, so that their family, their friends, their business associates, their whole community could see them and even throw things at them if they thought that'd be fun or if they were mad at them. And we're seeing some of that same kind of punishment coming in China, where police have been beating people for not wearing masks, tying them to pillars for not wearing masks. And it's just really unfortunate that that's happening. Scapegoating isn't productive. We can't blame a whole group of animals or a whole group of people for an outbreak. After the SARS epidemic, we saw that people were slaughtering civet cats like it was their fault. And people are afraid that since pangolins are suspected of possibly being the link with the current outbreak, that they might be targeted as well. And it's not the wild animals' fault. They don't want to be around people. When they see people coming, they run. It's people who are going out into the environment and coming into contact with these animals. And I think that rather than scapegoating, we should be looking at how this happened, how it was allowed to spread, and fixing those things so that we can hopefully prevent something like this from happening on such a large scale in the future. In the aftermath of the Black Death, there were changes in society. So you see things like in art, an obsession with the danse macabre, kind of a morbid fascination with death. You also see society changing. You see the Peasants' Revolt in England, La Jacquerie in France, and some people have even attributed the Protestant Reformation to having roots in the Black Death and how it changed how people perceived themselves and the world around them. And while it's true that the Black Death certainly did speed up these types of changes and maybe bring them on more quickly than otherwise, the seeds of all of these things were already planted and they probably would have happened eventually. It's just that the Black Death sped up when they happened. And we also see changes to the economy. So after the Black Death, the breakdown of serfdom became more prominent. Again, it was already happening, but it was sped up by there being fewer laborers and more land available. So you see things like laborers getting higher wages, but you also see things like food products being worth less money. And if you're, a working man, then that's a good thing for you, but it's not a good thing for the landowners or, we might say business owners. So there were efforts at the time by governments to artificially control some of these economic changes that were happening so that how they were used to seeing society could continue, and it had varying degrees of success. And we're kind of seeing the same thing with the current pandemic, where governments are injecting cash into the economy to keep things going, but we don't really know what's going to happen. Some things after this are over are going to be more expensive, some things are going to be less expensive, and it's not necessarily going to be that everything's going to be worse or everything's going to be better, but like the Black Death, it's probably going to be, a little bit of both. One thing that might be worth considering is that with the Black Death, we saw an acceleration of social change and an acceleration towards freedom. And in the current pandemic, we're seeing people call for more government control. And we're seeing governments, like in China, want to have more surveillance cameras, and they even have facial recognition technology that can identify people behind surgical masks. In France, we're seeing soldiers enforcing quarantine on the street, and in Canada, there was a bill that almost went through that would have given the finance minister pretty much unilateral control over taxes for the next couple years. And I just think that with the Black Death model, where you see social change being sped up and accelerated toward freedom, we might want to just keep an eye on things and make sure that we're not seeing a speed up in the current pandemic toward more government control and authoritarianism. So it'll be interesting to see what kind of changes in the style of government different countries are getting once the pandemic passes. The most recent instance of bubonic plague coming back into the human population that I'm aware of happened actually just in November. And a hunter in Inner Mongolia killed a wild rabbit and ate it and contracted bubonic plague. So it does come back into the human population, but the good news is with all three types of plague, bubonic, pneumonic, and septicaemic, that we do have treatments now where the mortality rate is much lower than it was during the Black Death. So even though this pandemic right now, we don't have any immunity to it, we're going to figure it out eventually, and it's not going to be as dangerous in the future as it is right now.